Hello, my name is Jordan Partridge, and I'm a BSN student at Athens State University. Today I'm going to be leading a health education program regarding the related community diagnosis of substance abuse, specifically opioid use in our community, Summerton, Alabama, at Walker County. So you may be asking, and many people may know, but the question would start with, what is substance abuse? Substance abuse is a disorder characterized by the use of drugs or alcohol that are continued despite them causing a significant impact in someone's daily life. Here in Walker County, we have the third highest rate of non-fatal overdoses in the whole country. And we still have almost 4 times a greater number of residents who've died in drug-related deaths than the national average. Opioid addiction is a huge problem here in our area, and today I hope to give you some information to help you, lead you in the direction if you're looking for help or if you have family members that need help, that hopefully you can get some understanding and move toward helping them in the right direction as well. So those were a few statistics, and I also do have some handouts I'll give just with more specific statistics, so you can have those to take home as well. Another question some people may ask is, where can I or my family members get help? Now, luckily in Walker County, not specifically in Summerton, but just a few miles down the road in Jasper, there are several resources that are easy to look into. One being Northwest Alabama Mental Health Center. There's Walker Recovery Center. There's the Walker County Health Action Partnership, and Bradford Health Services, which is in Warrior. Those are all great resources and great places to get help. If you are in a crisis or you have a family member you believe is in a crisis, the best thing you can do is to call 911. Now, this may not seem like the best thing to do. You love your family, you don't maybe want to be in trouble, but calling 911 can get you help immediately. There is a 988 number that is a suicide and crisis lifeline number that can also direct you to resources and get you help or your family members help. If money is a problem for going to rehab or getting help getting into some of these services, there are grants that are available in the area, as well as some churches that are willing to help people and to get them into services to help get them going in the right direction in their life and to get them out of this hole of addiction that has really gripped our area. I wanted to also give people a few minutes to reflect on your own addictions or to reflect on the addictions of your family members. It's hard a lot of times to just live in that. It's very difficult to take responsibility and to kind of want to turn around when this is maybe something you've known for a long time. This is just somewhere you've been stuck. But there is help. There is positivity. There is light on the other side. And I hope today to give you some of that light, to give you some of that hope, and to show you in a direction where you can reach out for that help. I have a family member, my brother, who was on drugs for a long time here in the area. He finally got clean, in and out of jail for a long time, and he joined the military and had a great life. There are opportunities. You can turn your life around. This does not have to be where you stay. These resources, these facilities, they can get you help. You do not have to stay locked in to this depressive state, into this addiction. There is help, and I hope that today you can find that help. Something else that's really important that I wanted to go over here in this session is a medication called Narcan. A lot of people have heard of this, Narcan or naloxone. That is a medication that is used to treat an opioid overdose. There are several ways this medication can be administered, but for the general public, the easiest way is intranasally. There are a lot of health departments and fire departments who do carry this, that you can go in and get these. They do come in like a little plastic bag or a plastic pill package. And these are good to have on hand if you have a family member who's in an addictive state, or if you are someone who does drugs and that you need to have that with you for yourself or for some people that you're with, just so if there is a problem, if there is an overdose, you can reverse that and that you'll still have a chance, and that we don't want that to continue. We don't want there to be death with this. When you can get help, there's something that you can have with you that can help. This drug is easy to use. Again, I said it's a nasal spray. It just comes in a little plastic pouch. There's 3 P's for the administration of this medication: peel, place, and press. It comes in a little plastic pouch, and you would just peel that away. And it comes with it has a little plastic piece that goes into the nostril. You just put your finger on it like this, and you put it into the nostril till your fingertips touch the edge of the nostril. And then you push the plunger up to give the dose of Narcan. Each Narcan spray comes with 1 dose, so don't try to test it. Don't try to reuse it. There's just 1 dose in each spray. So you make sure when you press that plunger, you press hard so all of that medication goes into the person. And then you want to roll them over onto their side in case they start to vomit. That is a big side effect from this medication. And this medication is really safe. If the person is having some other kind of medical condition and you think maybe it's an opioid overdose, maybe it's something else, if they are not having an opioid overdose, then it will not affect them. So it is safe to give in those situations. So signs and symptoms of an opioid overdose that are necessary to look for: the person may be overly sleepy or very slow to respond or unresponsive. They would have slowed, shallow breathing. They could have pinpoint pupils. Their fingertips may be starting to turn blue as they are starved for that oxygen in their body. So those are just some signs and symptoms to look for when you're looking to give that dose of Narcan, or you're wondering, is this an opioid overdose? Is it not? Just know that the medication is relatively safe to use on someone if you're not 100% sure. But if they're not having an opioid overdose, it's not going to have serious side effects. So I hope that information today was really helpful. I hope that you got something out of it. I hope you would continue to learn and to seek out resources. I do have, like I said, a paper with some resources and some statistics for you. I will hand out as you leave. And then I also do, if anyone would like to fill out, I have a survey just for what I've done today, just from my program. If you would please fill those out on your way out as well. Does anyone have any questions for what we've gone over today? No? Okay, perfect. Well, again, I have the survey for you if you'd fill those out, and the handouts. I appreciate so much everyone being here tonight, and thank you so much for your time, and I hope to see you in the future, and I hope that you get the help that you need for yourself or for your friends and family.